it's time for us to speak health. Dr. Maymunah Yusuf Kadri is a dynamic consultant neuropsychiatrist, and she's a fellow of the National Postgraduate Medical College of Nigeria with almost 20 years experience practicing as a physician. She's also a certified trauma counselor and neurofeedback practitioner. Thank you so much for brightening up our studio this morning.
Thank you, too.
I only wish that the topic we're speaking of today was a little happier. So today we're talking about postpartum depression. For those who are maybe tuning in for the first time or hearing about it for the first time, please, could we break down what that is exactly?
So basically what postpartum depression is all about is a depression after delivery, meaning post-delivery, meaning a woman after giving birth, she now has this depression. But we shouldn't take it away from the fact that some women may actually be experiencing these symptoms before the delivery. But that was when it was now diagnosed. So that's why we said it is postpartum depression. And it's quite common. It's quite common because the fact that women generally do experience depression more than men. For women, we do also find out that after delivery, about 10% of women do also experience postpartum depression. And these are this is an issue whereby the woman has this persistent sadness. So it's not a sadness of a day or two. It's a sadness of more than a day, more than 2 days, at least minimum of 2 weeks. And the truth is that this is a woman who has just given birth. She's alive, baby is alive. So, but people who don't understand the fact that why would she be sad if she had, especially if she had a normal delivery? You know, in this part of the world, if you have a cesarean operation, if you are not the Hebrew kind of woman, or this is a normal delivery, everything went on fine, and all of a sudden, you are not happy, you are not sleeping well, you are neglecting your personal hygiene. But this is what we are telling people. When that woman is perpetually unhappy, neglecting herself, start saying she's not eating well, she's not sleeping well. But most times they say, oh, you are a nursing mother. You need to eat well. You are a nursing mother. You may not be sleeping well. But you can see that the sleeping well is now affecting her health. And then she's crying. A lot of times you see them crying profusely, weeping, sometimes even wailing. That is not the time for the people around her to trivialize her issues or even be in denial. That
I was actually going to mention that because as soon as a woman gives birth, in my opinion, there is this bubble around the child.
Exactly.
So
everybody focuses on the...
Yes, they focus on the child and they tend to, I don't want to use the word neglect, but that is what it is. They neglect to actually focus on the mom. So you mentioned crying, you mentioned perpetual sadness. But what about attachment to the child?
That is also not there. So because there are too many people around most times, people are not seeing that because she feeds. So they'll bring the baby, feed your baby. She feeds the baby and then they take the baby away. They will not understand that there's what they call that bonding. She's not really cuddling the baby. She's not even interested. She pushes the baby away at any point in time. That interest, because lack of interest in things ordinarily you love to do is one of the symptoms of depression. So that bonding, that interest of wanting to hold our baby, cuddle our baby is not there.
I have to, there's probably someone nursing a child right now, you know, watching right now. And for, if that is you, the first thing I would like to say is, it's not your fault.
Exactly. Please.
You're not a bad mom.
Exactly.
But we're trying to get to the bottom of how to work on this problem. So what's the first advice that you would give, you know, people around a woman that's going through this?
Please, especially for our mothers. They love us, they care for us, they are happy they are now grandmothers, especially the first-time grandmothers. They need to understand that, yes, eating for two is much more than that. They need to look at the emotions of that mom, that woman, that, look, what is it? Is there any problem? You want to tell me anything? Is there any issue?
We have to keep this topic going, and we're going to be back after this quick break. The doctor is still with us. Welcome back. We're still talking health, and Dr. Yusuf Kadri is still in the building. We've been talking about PPD, postpartum depression. And we have quite a lot to still cover. Please share with us some cases or a case that you had to deal with.
The truth is that there are so many cases, but at least this particular one, that was her second baby. So a lot of times I need to also let people know that it's not just first-time mothers. It can be your third time that you're having a baby that you can have postpartum depression. This was her second child. She had a little girl, then this one was a little boy, and everybody was so happy. Her mom came, her mother-in-law came, siblings came, and then 3 weeks down the line, the mother-in-law stepped into the room and I was asking her, what about the baby? You've just finished feeding the baby. Can I hold the baby for you? She said, no, the baby is in the living room. And so the mother-in-law went back into the living room and then came back. She said, no, but I gave you the baby. Where is the baby? And then somehow it triggered the mother-in-law that something may be wrong and then pushed her aside. But it was already too late. She had suffocated the baby, sat on the baby, and the baby gave up.
So she was not even aware?
She wasn't aware that she did that. She wasn't even aware. Even when they finally brought her on admission, stayed for some weeks, she was still talking about the baby. 3-4 months down the line, she now started asking actively, I need my baby. I know I had a baby. And then the whole story started coming out again. And you know, the whole family was devastated. But all those symptoms were there. They didn't see it. She used to cry a lot. She was not talking about the baby.
So now the most important thing is seeking help.
That is it. Very important.
But there's a lot of stigma around seeking help.
Yeah. But the thing is that we should know that this is not the woman's fault. Seeking help is a sign of strength, not a sign of weakness of character. They shouldn't feel guilty. It can happen to anyone. Let me just tell the truth. A lot of us as mothers, we went through the blues because that's the first stage. Depression is later, then we can have what we call the psychosis. Most of us as mothers had the blues. So a woman shouldn't see that having a postpartum depression is a disease but seeking help on time is very key so that she can help herself and likewise help the baby so that at least we won't have what we call the infanticide. So seeking help is very good. And the truth is that seeking help does not necessarily have to be medication. It can just be therapy, counseling. That's the first step before.
Ting you so much,
any other
Doctor, for coming to talk to us about it. And once again, if there is a young mom out there, it is not your fault. Seek help. If you need it, please get help as soon as you can.